What if the smartest doctors missed something a machine caught in seconds? If you do not understand this shift, you are risking your own future health outcomes. This hospital case study will completely change how you view medicine. For decades, the hardest part of medicine was the waiting. Imagine sitting in a clinical room for years while specialists run test after test, only to tell you they still do not know what is wrong with your child. This is known as the diagnostic odyssey, and it affects millions of families globally. The average time to diagnose a rare disease is nearly 5 years. That is 5 years of worsening symptoms and agonizing uncertainty. Medical professionals are not failing on purpose. Human brains simply cannot hold the thousands of rare genetic mutations and obscure symptoms required to solve these puzzles. But a recent experiment at Boston Children's Hospital completely shattered this limitation. The breakthrough did not come from a new $1 million medical scanner. It came from the exact same language models you use to write emails. Researchers decided to feed complex, unsolved patient histories into an advanced AI model. These were not simple cases. These were 18 children whose conditions had completely stumped the brightest pediatric minds in the country. Wait. Before we go further, you need to understand how radical this is. Doctors were not asking the AI to search a database. They were asking it to reason through contradictory symptoms, genetic anomalies, and massive files of clinical notes. The machine had to connect dots that experts missed. And what happened next forced the medical community to pay attention. The results were staggering. The artificial intelligence accurately diagnosed all 18 children. Remember what I said at the beginning about human limitations. The machine succeeded because it could instantaneously cross-reference an entire century of global medical literature against a single patient profile. In one instance, the AI identified a genetic syndrome so obscure that most practicing physicians will never see it in their entire career. It parsed through dense medical jargon, ignored irrelevant data points, and delivered a highly specific, correct diagnosis. This was not a controlled lab simulation. This was real life, giving 18 desperate families the answers they had been chasing for years. But scaling this comes with a massive catch. You cannot just fire your doctor and consult a chatbot. The biggest obstacle right now is the hallucination rate. When language models invent facts about history, it is annoying. When they invent medical facts, it is lethal. That is why the Boston Children's approach kept a human in the loop at all times. The AI acts as the ultimate research assistant, generating highly probable theories, while the attending physician makes the final clinical judgment. If you are navigating a complex health issue today, you should actively ask your specialist if they are utilizing AI diagnostic tools to review your case. The technology is available right now. But the way hospitals plan to roll this out next will surprise you. We are entering an era where diagnostic speed costs pennies instead of thousands of dollars. The transformation here is not just about solving rare diseases. It is about fundamentally destroying the bottleneck in global healthcare. When a primary care doctor in a rural clinic has the same diagnostic horsepower as a specialist at a top-tier research hospital, the entire system shifts. The actionable part is coming right up, but consider the sheer scale of this. Routine misdiagnoses kill hundreds of thousands of people every year. Deploying these reasoning models at the first point of care could prevent a massive percentage of those errors. The technology is rapidly moving from a specialized experiment to standard operating procedure. And this creates a very specific opportunity for you. The power dynamic in medicine is permanently flipping. Within the next few years, every patient will have access to clinical-grade diagnostic models on their phone. You will walk into an appointment already armed with an AI-generated differential diagnosis based on your own wearable data and medical history. This is the part where it either clicks or it does not. The people who understand how to prompt these models with their health data will receive dramatically better care than those who rely entirely on the traditional system. We are looking at a two-tiered medical system, divided not just by wealth, but by AI literacy. You have to adapt. Subscribe and hit the bell so you are ready when the next massive breakthrough drops.